Afternoon, everyone. My name is Karen Edwards, and I'm pleased to welcome you this afternoon to our third set of talks in the CUPS Issues and Impacts series. Welcome to our session today, and thank you for taking the time to join us. Please know that we're recording our talks, so if you have to leave early or you missed something, all the recordings from our series are actually available on the School of Public Health's YouTube channel, which can be found in the link in the chat box. I'm going to start with a few points about our session today. We have many participants registered for the talk, so in order to make sure there are no technology problems, we've disabled all microphones and cameras except for the speakers, who we will spotlight, so you should not have to make any adjustments to your screen. Now, in the past, we have had a Zoom bomber gain entry into one of our talks in this series, so please do know that we have a support team in place in the background with a process, and we will promptly deal with any issues. So just hold tight if anything unusual should happen, and we'll take care of it in the background. All questions for our speakers can be shared in the chat box at any time. So if it comes to your mind during their talk, please feel free to put it into the chat box. We also have background support to bring those questions towards me, because at the end of their talk, I will pose the questions as the moderator to the speakers. I wanted to start our time together today, though, by recognizing and speaking to the land that we're meeting on. There are likely participants on our call from various geographical locations that reach across the traditional territories of many Indigenous nations. And honoring the land that we are on and the footsteps that have walked these lands before us grounds us and acknowledges the importance of relationships. I want to acknowledge the land on which I am standing and the wisdom and footsteps that have marked it for generations, and I encourage you all to do the same. Our speakers today come to us from Treaty 1 in Manitoba and the unceded Algonquin territory in Ontario. Now, the place where I live and join you from today is acknowledged to be the territory covered by Treaty 6 and Region 4 of the Métis Nation of Alberta, a traditional meeting ground and gathering place and traveling route for many Indigenous peoples for centuries. And by acknowledging this territory, we respect the histories, languages, and cultures of First Nation, Métis, Inuit, and all First Peoples of Canada, who enrich our vibrant communities. A treaty is an inheritance, a responsibility, and a relationship, and we are all treaty people, beneficiaries of the peace and prosperity that the treaty brought, and committed also to working towards the equity and justice that the treaty promised. May recognizing our status as treaty people help us to be good neighbors to one another, good stewards of the land, and good ancestors to all our children. I also want to express how heavy our hearts have been this past week with the recent news of 215 children's graves that were found at the Kamloops Indian Residential School. Is one where engaged communities support the well-being of children, youth, and families, and I encourage us all to reflect on how we can take action in our own lives and in communities to be allies in the immense healing that these children's families, communities, and our nation needs right now. It is important for all of us to be engaged. I encourage you, if you have not, to read the Truth and Reconciliation Commission report or its call to action, or to look at resources like 150 Acts for Reconciliation. These resources help us determine how we can engage in reconciliation each and every day. Sinead is going to be putting those links to those resources in our chat box. Many of you on the call today know CUP, and there may be some who don't. So I'm going to take just a few moments to tell you a bit about ourselves and our series. CUP's a research center at the School of Public Health at the University of Alberta. And for 20 years, we've worked closely with community organizations, researchers, practitioners, funders, and policymakers in Edmonton and across the province to identify issues of concern to the well-being of children, youth, and families. And in response to those issues, we collaboratively create research and evaluation projects. We generate evidence and mobilize it into practice programs and policies. We have numerous community partners who have been on this journey with us for decades, and we wouldn't be who we are without them. This year, CUP This past year, CUPS celebrated its 20th anniversary, and you can see a link to our 20th year celebration page on our website, which we'll put in the chat box. And this series of talks has been a kickoff to that celebration, and it's carried us well into our 21st year. This series is a way for CUP to bring attention to issues and attention that are relevant to our current research projects with communities. And each segment of the series helps us engage field experts and local partnerships. The field experts speak to an issue of concern, and last time we had Michael Quinn-Patton and Mark Cabaj join us. And then the local partnerships talks help us have a more intimate discussion of local work happening on the ground to help understand and achieve impacts on the same issue. So December, we focused on community-based participatory research. In February, we focused on early learning and care. And these last two talks have turned our attention to transformational evaluation and capacity building. But why capacity building? As the impacts of COVID continue to reveal themselves for families and for the sector, we know these issues will require capacity and resources for the decision-making to come. And that's why I'm pleased to welcome our three speakers today to share with us the national scope of the evaluation capacity and resources that have emerged through our very own Evaluation Capacity Network. Our speakers today are Rebecca Gokiert, who's an engaged scholar and works in partnership with early childhood stakeholders, immigrant, refugee, and First Nation communities. She's the director of the Evaluation Capacity Network, a partnership initiative that bridges community university evaluation gaps to improve practices, programs, and policies in the early childhood field. Rebecca is a registered psychologist in the province of Alberta and provides consultation and individual assessment to school boards within Alberta. Javier Mignone is a professor in the Department of Community Health Sciences at the Rady Faculty of Health Sciences at the University of Manitoba. He holds a master's equivalent degree in psychology, a master's in health services administration, and a PhD in community health sciences. Javier teaches undergraduate and graduate courses, including program evaluation and social development. On a regular basis, he leads workshops on health information and program evaluation for not-for-profits, including Indigenous organizations in Canada and abroad. Javier conducts research and development projects on intercultural health and health information with Indigenous partners in Guatemala, Colombia, Argentina, Dominica, and Canada. As well, he's been involved on HIV prevention interventions and research in India, Colombia, and Canada. Javier leads the Program and Policy Evaluation Research Group at the university. And finally, Isabelle Bourgeois, an associate professor and vice dean of research and professional development at the Faculty of Education in the University of Ottawa. Her ongoing research work focuses on measuring and building organizational evaluation capacity in the public and community sectors. She is currently the principal investigator of the Labo Eval, a laboratory engaged in the study of evaluation capacity in community-based organizations. Dr. Bourgeois is also currently the editor-in-chief of the Canadian Journal of Program Evaluation. In 2017, she received the Carl Boudreau Award for Leadership and Evaluation from the National Capital Chapter of the Canadian Evaluation Society. So welcome to all three of you, and I invite you to start sharing your screen.
Thank you very much, Karen, for the warm welcome and the lovely acknowledgement that you gave today. So I'm here with my colleagues, Javier and Isabelle, to talk to you about transforming evaluation capacity in the social serving sector. So I'm going to walk you through the development of our network first, how that's resulted in a hub model, and then I'm going to pass it off to my colleagues to share some of the exciting work that they're doing across Canada. So I'm part of the Community University Partnership, CUP, that Karen already shared some information about. We have a very long history of supporting, 20 years, 21 in the making, of supporting individuals and organizations across our municipality and province with research and evaluation. So the requests that we get range anything from needing support of a graduate student, help building evaluation frameworks, maybe identifying screening and assessment tools that are appropriate to their context, or taking on a research or evaluation initiative. We often work closely with our early learning and care, health and education sectors, and community-based organizations that support children and youth in our communities. the sheer volume of requests that we were getting from the social serving sector and more broadly, and the early childhood sector more specifically, was really outweighing our ability to respond. So we determined the best way forward, because we like to collaborate, was build an interdisciplinary and intersectoral network, which we called the Evaluation Capacity Network. So we're here to share some of that work today. The role of the network is really to better understand the needs and assets that exist in our communities and build a response. So the images that you see on the screen really illustrate an initial needs and assets assessment that we conducted in our province of Alberta several years ago. We hosted 4 dialogues across our province with over 122 stakeholders that represented 78 organizations. You can find the reports from these dialogues on our website, which we'll put in the chat. Stakeholders ranged from frontline workers, educators, to policymakers, evaluators, and leads of community-based organizations and funders. Across these dialogues, we learned that individuals and organizations were really in need of some kind of centralized hub or space around evaluation that was both physical, they could walk through a front door and talk to somebody, we hope we get back to that place soon, and virtual, where they could really engage with others, access learning opportunities and resources and support. The participants also shared that they wanted evaluation to be meaningful and a meaningful experience in their work, and they wanted it to be community driven and culturally responsive and action oriented. They wanted to be able to do something with the evidence and information they were gathering, with the ultimate goal of transforming practices, programs, and policies. So to support the network, we received a 7-year Social Sciences and Humanities Research Council SSHRC partnership grant to do this work. So we have kind of a core nucleus of partners. We have 19 co-investigators, 9 collaborators, and 22 partner organizations and academic institutions across Canada and the US, and we're all taking action on these identified needs. I see many of our friends and new friends on the call today. So if you have any questions as we go along, pop them in the chat, and I'm sure one of our partners or network members can respond. So we've placed our project on a developmental timeline, much like that of a developing child. While we're starting year 3, and I recognize a 3-year-old does not really look like that, we're very much still in those early years. So we're exploring our environment, we're learning as much as we can, we're observing, we're taking it all in, and we're definitely making mistakes, but we're learning from them. It's our hope that more individuals and organizations, like all of you on the call today, will join us in our learning journey and really help us shape ECN as it's developing. 3 main objectives guide our work. The ECN will continue to deepen our understanding of how evaluation can become a community-driven and culturally responsive mechanism for improving early childhood practice programs and policies. We'll accomplish this through continuous engagement with our network and broader community. And as Karen alluded to, we know that the last few years have been, in terms of fiscal constraints as well as COVID, that the needs have likely shifted drastically, and we need to get our ear to the ground to find out what the needs and assets are currently in the community around evaluation. The ECN will co-create and implement research and evaluation on community and culturally responsive evaluation projects that are going on, innovations that are happening in evaluation capacity building, and how evidence can be used in transformative ways. And finally, the ECN will develop a centralized hub that will connect people to evaluation resources, learning, and support, with the goal of mobilizing knowledge and building evaluation capacity. So in the slides to follow, I'm going to talk a little bit more, get kind of into the nuts and bolts of how we are accomplishing some of these objectives. So we're in the process of developing an evaluation hub. Really, we see this as the major vehicle for our network to reach its objectives. And currently we have to do much of that work in a virtual space. So currently it sits within and housed in our website. The hub has 4 primary engagement pathways. So the ECN supports individuals and organizations to get connected to a network of peers, colleagues, and mentors to support their evaluation work. So this includes pathways for learning about evaluation capacity opportunities by receiving our newsletter and receiving information through our social media platforms or visiting our website. And you can join our network just by visiting our website and signing up. Connecting to expertise and resources from across the network, getting access to consulting and mentorship, or providing consulting and mentorship support and evaluation to our network members, and contributing and participating in networking opportunities across Canada. The ECN has several opportunities for our network members to learn together to build individual and organizational capacity. We've already created and are offering formal and informal learning opportunities. So in the credit space, because we are housed in the School of Public Health at the University of Alberta, next week we're going to offer our third version of UEval. And this is a one-week evaluation institute here at the University of Alberta, which actually I visited Javier many years ago to learn from his institute. We bring together undergraduate, graduate, and continuing and professional education students to wrap them around community-based cases to develop evaluation frameworks for organizations. By the end of next week, we will have had 120 learners take UEval, and we will have responded to 19 requests for community evaluation frameworks. We have several tailored learning opportunities that you can check out on the website. These typically involve partnerships with network members to deliver evaluation capacity training in different contexts for different audiences. And many of you joined us a few weeks ago, as Karen mentioned, to hear from Michael Quinn-Patton and Mark Cabage, and you're joining us today. So we plan to continue our speaker series on topics of interest and relevance to our network members. So if you have got any ideas around that, topics or speakers that you'd like the network to showcase, please feel free to put those in the chat, and we'll make sure that we try to respond. Our network members can share, access, and use a rich repository of network resources to move evidence to action. So this is essentially the co-created and curated toolkits, literature, case examples, practice briefs, evaluation tools, and other capacity building sites that are really useful to our network. And finally, the ECN supports the co-creation of knowledge through collaborative research and evaluation projects. So we're really interested in studying what we do and sharing that with others. So we've led, or we're leading, several projects that span, everything from systematic or scoping reviews to examine what evidence exists in the literature and the gray literature and in community, building capacity through really innovative teaching pedagogy and studying that, co-leading evaluation projects with particular approaches, so such as a participatory evaluation of a supportive housing model for teen families, and two more recent projects, one examining early learning and care experiences of immigrant refugee families, and a principle-based evaluation of a newcomer health clinic. So if you visit our website, you'll see the many resources, opportunities, and ways to engage with the network. But I'd really like to pass it over now to my colleagues that have joined us today, Drs Javier Mignone and Isabelle Bourgeois, to share two innovative capacity building initiatives that are really transforming evaluation use and influence within the Francophone, Indigenous, and rural and remote communities. So over to you, Javier.
Great, thank you, Rebecca. Thank you, Karen and CUP in general, for inviting me to talk about an initiative we're starting now, and with partial support actually from ECN. So this partnership for us has been very fruitful already and will continue to be so. So basically, I'll just share a little bit of what a new initiative, which is the Manitoba Northern and Rural Institute in Program Evaluation. We have not implemented it yet. We are at the planning stage, but we will be starting in October. But just first of all, I wanted to talk a bit about the background of it. We have for over 10 years been doing Summer Institute in Program Evaluation, which actually Rebecca mentioned. And over the years, we've done it 8 times with roughly a total of 450 individuals and roughly 50 community agencies that have participated. We also once did, I don't mention it too much because I forget about it. We actually did a Northern Institute once in the winter, so we can't call it a summer institute. It was a winter institute in Flin Flon, Manitoba. So this actually, the evaluation that we've been doing of the institute in general has showed that its success in terms of providing evaluation capacity opportunities for social agencies of very different type, both community-based, even up to some level of government as well. So in that sense, it's been very good. One of the issues we, in our assessments of the Institute, we had a few limitations and gaps. One had to do with the issue of follow-up with the organizations to support them a bit, or support them better in implementing the evaluation plans that were created in the Institute. And that's something that we're seeking to address more and more. Another important gap was the one that you see here, and I don't know what color that is. Anyway, I'm bad with colors. The point is, it's a gap, the fact that we knew and more received concern around this, that organizations from northern rural Manitoba had a lot of difficulty to be able to participate in the Summer Institute that we were holding in person in Winnipeg. It was a 1 week intensive, and obviously both cost and time were significant barriers to these organizations. So what happened because of the pandemic, first of all, we had to cancel the Summer Institute, the in-person one. And second, because of the pandemic, you know how it's said that a crisis is an opportunity. We thought, okay, why don't we, now that we're in a way forced to work more from the remote delivery approaches, why don't we use this time to develop and implement an institute that can be provided through remote delivery to northern and rural Manitoba. And so that is, thank you, Shelley, for passing the slide. I should have. And so that's what the stage that we're at. And let me talk a little bit about that. First of all, the format and the principles behind this Northern Institute are very similar to the Summer Institute that we've been doing, in which we engage, obviously, people from different nonprofit sector agencies as participants in the Institute, as capacity building, but as well, we include university students, both grad and undergrad, as part of the learning experience. It's a win-win for everybody because we are offering a lot of the materials and things that we teach at the university to people that that want that type of information. At the same time, we learn tremendously from the organizations that are participating in the Institute. So they enrich the Institute itself. And finally, for students, it's really being able to work with what we call real life situations around evaluation. And not only evaluation, but further, as the ECN has as well, the idea of evidence use, utilizing the evidence and how it's done in the real world or not done, which is a big issue. So what we're creating, which will start October the 5th, will be this remote learning institute will be held 2.5 hours, 2 times a week for 6 weeks. And we will be using a digital platform called House Space. So the format, again, will be synchronous and asynchronous in the sense that people can participate live for lectures, but they can also, if they can't attend those particular times of the lectures, they can listen to the lectures and see them through recordings. For the teamwork, which is a big part of the Institute, there, of course, people do have to attend live, so synchronously. Why are we using this particular platform? By the way, I'm not advertising it. I don't get paid to advertise this, but we have worked in Colombia. We're doing a diploma program with a large indigenous health organization there. And we've been using for this diploma program precisely this digital platform. And we have found it to be very good for a number of reasons. Because obviously it includes the possibility of video, it includes the possibility of recording. It allows, it's very amenable to creating teamwork or even one-on-one work at the same time that the other things are going on. It allows to obviously post a lot of different materials. And it also has some tools that are other platforms, of course, have as well, but like, word clouds or internal polling, etc. The bottom line is it's a Finnish company. Apparently, not much of that data goes through the US. That's what we've heard. I don't know how real that is, but that for us was an added value to this. But the point is that the launch, we're developing in, next slide, please, Shelley, with partners. And let me mention a few. These are obviously very important partners. I'm from University of Manitoba, which is the Program and Policy Evaluation Research Group proper. One important component of the Northern and Rural Institute will be that we will have Western, let's call it Western, just to simplify, approaches to evaluation, but we will have Indigenous approaches to evaluation. That is being essentially developed with our Indigenous scholars, colleagues that are part of the First Nations Health and Social Secretariat of Manitoba, which is a research center linked to the Assembly of Manitoba Chiefs, and knowledge keepers that are involved in developing that particular content, which will be part of the entire institute. So they're a strong partner in this. The Canadian Evaluation Society of the Manitoba chapter is also part of this. Some colleagues from University of Winnipeg, United Way of Winnipeg, and of course ECN that has provided some partial funding for us, which has been very, very helpful. There's a few more partners that I have not included here, simply because we're formalizing that a bit more. We're hoping to finish formalizing the partnership with some of the First Nations tribal councils in Manitoba and a few other, particularly through Red River College and University College of the North, some early childhood organizations. So I have a few minutes left. Thank you. Next slide, please. And so bottom line, what we will be doing is similar to the Summer Institute, remote learning, which will obviously increase the participation, hopefully, we're hoping, of Indigenous organizations in Northern Rural Manitoba, early childhood and health and social agencies. Again, as I mentioned before, including graduate and undergrad students, and as I already mentioned, both Western and Indigenous approaches to evaluation. The final thing I want to say is that the Institute, you can actually go to the last slide, sorry, thank you, is a virtual space for the Institute itself, but also we will continue utilizing it as a follow-up with the agencies to support them in the implementation of the evaluation plans that will be developed at the Institute, which again addresses one of the gaps that I had identified earlier. So in that sense, we're quite happy with the progress we've made and really grateful to ECN for the support. I hope I'm okay with time. Thank you.
Thank you very much. I guess I'll hop in and start. So thank you, Rebecca and others for this lovely invitation to present the Labo Eval. So just to give you a little bit of context about our lab and where we're situated, we developed our lab to support community-based organizations in the province of Quebec that deliver or support the delivery of health and social services. There's about 8,000 of them in the province, so we certainly have our work cut out for us. In general, these organizations have very limited evaluation capacity, and in fact, most of them are very small grassroots organizations that also take on advocacy roles through their members and their volunteers. So given the increase in accountability and reporting requirements that are coming from their government funder, there's a high level of interest in evaluation within these organizations and how evaluation can be adapted to internal decision-making processes as well as external accountability. And I would say they're even more interested in how they can use evaluation internally to make decisions about their programs and initiatives. So next slide, please. So what is our lab? Our lab provides support, as I mentioned, to community-based organizations all over the province of Quebec who are interested in developing their own evaluation capacity. So we do not evaluate for them, but we do support them in different ways, and I'll walk you through those things, those ways in a minute or two. So recently, our lab offerings have been only in French, but we have started to expand our lab's activities to English language organizations in Ontario through a series of opportunities and contacts. Being located at the University of Ottawa and being right next to the province of Quebec, just across the river, has opened up sort of both provinces to the work that we do. We're just starting those relationships with English-speaking organizations, but we can definitely see that there are some opportunities and there's some need and definitely some interest there too. So on the right side of the slide there, you have a list of all of the organizations that we're working with at the moment. It's not even a complete list. There are a few others that have joined us since then. It's quite a diverse set in terms of the size of the organizations, their organizational mission, the resources that they have. So for instance, we have 2 food banks, 2 organizations that work in the area of LGBTQ+ support. An organization that works with new mothers to provide them with respite and support in the first 12 weeks of their child's life. An organization that provides in-home services to elders, a group home for youth facing mental health challenges, an organization that provides support and follow-up to patients who've had cardiac events, organizations who provide services to new immigrants, you name it. And we've pretty much seen it even within these first few years of the lab. So these organizations, many of them are quite small and supported only by volunteers, but we do have some that are quite large and have 60+ staff members. So you know, variety is really at the heart of this project. But what these organizations all have in common is their dedication to their clients and to their communities, as well as a real interest in improving their services, their decision making, and they're all interested in learning. And they come to us. We open up recruitment and we send out emails and we make phone calls to recruit organizations, but they really come to us because they're very keen on building their own capacity. And that's really the main criteria, I would say, to join the lab. So we'll go on to the next, thank you. So here you have an overview of the 5 steps that we engage with all of these organizations. It's clear that given their variety, we can't adopt a one-size-fits-all approach to all of these organizations, but we have developed sort of a process that we walk them through and that we customize to each of these organizations' needs. So you have the 5 steps here, and I'll just go into a little bit more detail in the following slides, just to give you a sense of what that entails. So the first step in the intake process consists basically in an initial meeting with, you know, the organization's contact person. Sometimes that's the executive director, sometimes that's the president of the board or coordinator, to discuss the project, to review the consent form together, and to get sort of that work out of the way. This is really an opportunity for us to get to know each other and to see if we can work together. And so once that's settled, then we can move on to actually working together. And we conduct, in most cases, an assessment of the organization's existing evaluation capacity. So we need to know where they are and what they have in order to think about the best way in which for us to support building further capacity. And so this assessment can be done in various ways. It depends on the organization, but generally we've developed a tool through empirical research that's adapted to the context of community-based organizations. So you have the screenshot there on the slide, as well as the link that I believe Sinead just put in the chat for you. The tool is free to use. It's a Google form. And if you use it, you'll be asked for your email address, and then I or one of my research assistants can send you your results afterwards. So you can try it. it's free, and it'll give you a sense of what your organization may look like in terms of current evaluation capacity. So once that's done, we start building evaluation knowledge and skills. And what we've done is we've set up a 7-module online evaluation course specifically tailored to the community sector. Each module includes various elements, a video of a PowerPoint, as well as workshop exercises to be conducted within the organization. We developed this whole training program through a participatory curriculum development process that included representatives from the community sector. And so we're fairly confident that what we are covering here addresses the needs and the terminology and the ways in which nonprofits work. And for the moment, the material is only available in French, but if we continue to receive support requests from English-speaking organizations, we have plans to expand that to English as well. What's really important, though, is that throughout these 7 modules, a research coordinator is always in contact with the organizations to make sure that the training is going smoothly and to provide additional support and resources as needed. And we find that personalized contact really important in maintaining the interest of our participants and in helping them through the process. So we, our coordinator, has regular contacts, regular phone calls, meetings. I jump in when I'm needed as well, just to make sure that the process unfolds as smoothly as possible and that the organizations really get something out of it. So as part of the training, so during the training and the capacity building process, we also help them develop their evaluation plan as well as data collection and analysis tools. So we do this in different ways, but technical support is usually what we do there. So we provide them with additional knowledge, and we review data collection tools for them, and we help them build what they need. And ultimately, the idea is that these organizations will have the plans and the tools that they need to continue evaluating their initiatives on their own. So longer term sustainability is really what we're about here and what we're trying to develop in these organizations. And so you have different examples there on the screen of how we support organizations that are taken from current projects that are going on right now. So once the evaluation plan and tools are developed, then of course we move on to the evaluation phase. And so once again, our job is really to support and assist the organizations as they implement and start to collect data. And the idea is they do it themselves so that they learn by doing, and we're there to support that throughout. We do find, though, during this phase that sometimes they need a little bit of extra support as they're building their own capacity. So we have students who are research assistants, members of the lab, who support this work. So sometimes they'll conduct interviews or they'll conduct telephone surveys, and we have different examples of, sometimes the organization, the one person who would be best positioned to conduct the survey with clients doesn't want to because they already have a well-established relationships with these clients, and they feel the clients may not be as critical as they ought to be. And so they prefer to have students call. In one case, we had an organization where we're working with, as I mentioned, new moms. And so one of our graduate students was a new mom herself. And so she's the one who conducted the survey. And that went really well because then the clients really opened up, and it was a really nice way to collect data for that particular organization. So we jump in when we need to. And then finally, the research component of this, because we're a research project first and foremost, is that we also want to capture these experiences through case studies and process tracing. So while the organizations are engaged with us, we will conduct punctual data collection with them through interviews and surveys and other conversations where we're collecting information that helps us develop an organizational case study for each one. And what that helps us do is that eventually we'll have enough case studies with enough organizations that we'll be able to sort of analyze those together and, dig a little bit deeper into what kind of strategy works for whom and in what kind of context. And we feel that that's a really important next step in terms of pushing forward the knowledge that we have on how evaluation capacity can be built in community-based organizations, and to develop robust data that support some of these conclusions. So that's sort of our longer term process. But what we also do is throughout the project, we have various smaller research projects that we're also conducting at the same time, so we can continue to contribute to the advancement of knowledge throughout. And so just finally, in terms of how we actually do all of this, the lab is funded through a SSHRC grant for 5 years. And so that basically helps us support a research coordinator who works on the project 4 days a week. And he's really the person who handles the day-to-day administration of the lab. He's the key contact, he's the key facilitator, he's the coach for the participants. They call him, and then, as I said, I jump in occasionally when I'm really needed. And then we have other research assistants who are assigned to support him and to help with research activities mainly, so collecting data that pertain to our research papers. And to do, like I mentioned, occasionally, sometimes conduct data collection on behalf of the organizations. And so what we've discovered we needed over the past year or so is a detailed spreadsheet that help keep tabs on all of these organizations. We have about 12 working with us right now, and because we don't do a cohort system, each organization comes into the project at a different point in time. And so we need to be really, really clear about where they are and what they're working on and what the follow-ups are that we need to do in order to make sure that they feel well supported throughout the process, and that we know what everybody's up to. And we can, if we see that people are lagging, we can sort of go and get them re-engaged with the process. Other than that, I talked about our research productivity. We have a plan in place to continue to produce knowledge throughout. And again, as I said, we have English language resources that we're starting to develop and implement this year. And if all goes well, then we'll develop those more fully in the years to come. So I'll stop here. Thank you very much for inviting me again to speak about this work.
Fabulous. Rebecca, maybe you can unshare. Great. Well, I have a whole lot of questions to ask you, but and it's going to be tough not to throw in my own, but I promise to the people who are participating that I'm going to stick to your questions and not my own, unless I run out, but it seems like I'm not going to. So the first question that I'm going to pose, and maybe it'll become clear if it's a question for all of you. I'll do my best to point it to someone if it is pointed. So first question is, working with a group doing healthcare embedded in a seniors social services organizations. That's what this individual is doing. The evaluation metrics are very tricky, and funders' indicators aren't always capturing the effects of an integrated service delivery system. Any suggestions for resources? That's kind of an anybody question, I think. Anybody want to jump in?
Maybe I'll just start. I can't think of resources off the top of my head, but I think it's certainly something that we could get back to. I remember that question came earlier in the chat, but we could get back to you. I think it's one of those, and I think it goes to another question that comes up later, is kind of balancing some of those expectations around funder requirements and indicators and what the program itself actually finds meaningful or actually wants to collect and make sense of and use. Always, and I'm just thinking about, we just had a conversation with our students about this. It's always about conversation. So how can you have a conversation with that funder to say, we really need to capture this integrated model. So yes, those indicators are important, but we have to make sure, because this is where the unique pieces are happening here, is in the integration. So, looking at different techniques around process evaluation, right? I think that's the way to capture some of the integration. I don't know, I'll ask Isabelle and Javier. So there isn't sort of a tool, I don't know, that exists, but I think there's certainly lots of good literature, case examples on that we could probably pull together and share.
Yeah, I would also, sorry, Isabelle, do you want to say something?
No,
first?
go ahead.
I would also argue that it's also worthwhile to do a bit of pushback to funders, to not be afraid to do that. And we've had some positive experiences with that. It's almost, we need to also educate funders. We should not forget that, particularly around indicators. They have this sometimes magical thinking around indicators that doesn't make much sense. And so, but going back to what Rebecca, so in a way you can combine both what's relevant to the organization, but also to some degree response to needs of the funder. But again, the conversation that Rebecca was talking about should, I think, also include a bit of that pushback and say, look, this doesn't seem to make sense to us.
Yeah, I agree. I was going to say that too, that educating funders is often, unfortunately, part of the work that we all collectively have to do, but that it is feasible and it has been done. So there's some hope there. Also, thinking about evaluation metrics as not only belonging to the funder, but feeling comfortable in identify evaluation metrics that work for you as well. So it's not necessarily an either or proposition. You could probably integrate both, but there, and like I said, I can't think of any other resources as either, but we can look for some for you, because there are examples of this being done quite successfully.
Yeah, and if it feels like that funder push is the that funder push is that systemic piece of what we know this work can do, right? Is pushing back at that systems level piece for evaluation. Okay, the next question I have is from someone says, I would love to hear more about the process and some of the different ways that evaluation is happening from an Indigenous perspective. How the questions asked vary, data gathering approaches, outcomes, and indicators vary as well. So I'm assuming maybe this is for you, Javier, given your focus, but also others.
Yeah, okay, sorry, I couldn't unmute myself. Unfortunately, I won't have a direct response to the question because it's obviously a very complex question. First of all, there are a lot of groups that are working, developing obviously different approaches within Indigenous approaches. And that makes sense because there's no pan-Indigenous one vision of things, which it's very important to always keep in mind. The way we have done, so for instance, for this institute, precisely we're working with Indigenous scholars, Dr. Wanda Phillips-Beck and knowledge keepers to develop, let's call it a bit more of a Manitoba context-based approaches in the evaluation. But in specifics, I remember working precisely in Colombia, one of the issues that was reworked most was precisely around indicators and how the redevelopment of indicators from the Wayuu people's perspective around evaluation. So of course, this covers all the basis of what the question asked. So sorry, it's not a very direct question, but it's difficult to answer in such a short time.
Any other feedback from Isabelle or Rebecca?
If I could just make a little pitch for the Canadian Journal of Program Evaluation.
I just put it in the chat.
Excellent.
Searching for it.
Awesome, thank you. We do publish quite a few articles that focus on Indigenous perspectives in evaluation and experiences in evaluating within Indigenous communities or with Indigenous communities, often written by Indigenous evaluators and scholars. So we have quite a good number of them published, and I can't give you the full exclusive right now, but there will be an announcement made very soon about the CJPE and a brand new section that will have something to do with Indigenous evaluation. And so that will be announced over the next couple of weeks, and it's super exciting. So stay tuned for that. And all of the papers in CJPE, of course, are open access, and so they're all free and fully accessible.
Yeah, and Isabelle, I just put in the chat the special issue that came out.
Yes,
I think in 2020, and so
yeah,
and I think the link will take you to all the different articles that were in that particular special issue.
That's right. Thank you. So there was a special issue, and then we published them before, and we continue to publish articles pertaining to Indigenous evaluation as well now. So there's a whole lot of them to look at.
And the open access is super important when it comes to not-for-profits, for sure. So, okay, next question up. From my experience, many community-based organizations are required to produce evaluation, but have very limited resources to actually do it. So how do you straddle the tension between robustness and practicality? Isabelle, you want to start?
Sure. So that's a great question. And it's a question that we think about all the time in our work. And I have conversations with my research coordinator and my students about this all the time, because what they're learning in school is the importance of robust data collection. And what we find in the field is that it's just not practical. So, so what we do is we focus on rigor, adopting a systematic approach, being clear about how you plan your evaluation, developing tools that are developed through rigorous approaches, but that are realistic. And so sometimes that means, like I said, a telephone survey being conducted with new moms, because it's the best way of reaching them, and settling for, you know, a 30-person sample, even though there may be 150 participants in the program, because new moms just can't even take 5 minutes to answer a phone survey, right? So it's really about reassuring the organizations that we work with that the information you're getting out of this survey is still useful, and you can still learn from it, and you can still think about it in terms of what can it do for you, and you can still explain that to your funders as well when you need to. So it's really about getting comfortable with that discomfort, I guess, for us and for many of the organizations that we work with, and accepting it.
Anybody else want to add into that?
I'll just add, I guess, a practical side of it. In part, we see as our mission with Proper and others to also engage and support organizations in the process. So the advantage we have being from a university is that we can engage students, grad and undergrad, that can actually support with resource in terms of person power to help support the organizations in decisions that the organizations made, essentially, in terms of evaluation, but supporting with helping with data analysis of certain things, etc. Time consuming, resource consuming. So we can. It's remarkable how much it's able to be done that way, and it's everybody wins, actually. So it's and so the more we can do that, I think the better it's for everybody.
Rebecca, anything to add?
Oh, probably all kinds of things. I think just picking up on Javier, that, you know, for community, and certainly that is the, you know, that's why CUP is around, and that's why the ECN was built, is really looking to your capacity organizations in community, and also university has a huge capacity, and figuring out those, you know, pathways in to connect, because there is a lot of expertise, resources. We have, you know, huge community service learning initiatives on campus that students are looking for applied experiences, and they want to connect. And certainly UEVAL that we're about to offer, that is very much having community-based organizations come to us, and we put that call out, and oftentimes those students end up following up with those organizations in various ways, you know, for their internships, or, you know, paid, unpaid work, volunteer, because, you know, students are pretty amazing and doing amazing things. I think too, and I guess it's many of the points in here. I saw Jimmy had a point around, you know, evaluative thinking, and, you know, really kind of looking at, we always teach, of course, our students, and when we're working alongside community-based organizations, is that context does matter. So we have to really look at what is realistic, what is feasible. And while a method or a methodology might be the very best or the gold standard, it's not actually practical or feasible in the context in which it's happening. So we've certainly learned that, you know, doing lots of youth engagement. Your example, Isabelle, working with new moms, right? So we really, although we may want to do things in a certain way and systematic way, we also have to be very realistic about, you know, our participants, and also the capacity of those that have to collect and make sense of that information. And again, I think it drives that you have to have that conversation when you're applying for that, you know, funding with your funder about what can you actually collect and what makes sense, right? And maybe you put something in the application in the beginning, and you have to have a conversation about the reality of that now that you're actually delivering the program.
I think that's part of the relationship as well, is kind of shifting the relationship between, like, just being the fundee funder sort of thing, is that this should be a relationship of, if we're doing our jobs properly, we're shifting that relationship, we're shifting how they talk to their funders and how their funders understand what's happening. And I think somebody had mentioned it in one of your parts of the talk, but I think it was you, Rebecca, but, you know, also what's not working. Like, you know, you can try things, but lots of times people I find are afraid to go back and say, oh my God, we spent this time doing blank and it stunk. You know, we didn't get what we thought, or something went wrong. You know, that's a reality of how these things unfold. So I think sometimes changing and shifting that relationship, and I can see in the chats, if people are watching, that there's a lot of back and forth conversation, which is amazing. We try and capture that actually at the end as well as the call, but trying to capture the conversation as well, because there's a really good conversation going on there about funders and just the role that they play. You've also already touched a little bit, I think, on the evaluative thinking question that Jimmy put in there. One of the things I don't want to forget to ask, somebody asked about the cost of your training, and that's specific to you, Isabelle. Someone was, and Rebecca tried to answer, but she's like, I'm not sure. So what is the cost of the training that Labo Eval provides?
It's free.
That's 7 module. It's free. There you go.
Totally
folks.
free. If you want to get started, you just need to contact myself, I guess is the easiest way, and I can refer you to our research coordinator who gets you organized. It's only in French right now, so if you speak or understand French, then that's perfect. And if not, then we'll have English resources coming in the next couple of years, but well, hopefully sooner, but you know, we'll see. But if you're ready to start now, it's in French and it's all free. Thanks to our friends at the Social Sciences and Humanities Research Council.
Fabulous. That's never a bad thing. So this is another question for you, Isabelle. Someone was just wondering if a municipal government department could also use the evaluation capacity assessment and receive the results.
So you could, but I have another tool for government organizations. My original tool was actually built for government organizations. The public sector is where I started out. So, so I see Christine asked that question, and Christine is our wonderful CJPE social media coordinator. So we'll touch base, Christine, and I can share all that with you.
Fabulous, fabulous. Javier, I'm curious, will you accept learners and cases from outside Manitoba? How can others replicate the model or create rural remote opportunities in their jurisdictions?
Thank you for putting me in a hot seat with that question.
That's what this is for.
Yes, in fact, we were having that question about Winnipeg as well. I mean, because it's Northern Rural Institute and what if Winnipeg organization. So what we're saying is this. Yeah, I would say as long as we have the capacity, yes. So we're not going to exclude just because of any rule. As long as we're meeting let's call it the priority, which is northern and rural, yes. And so, yeah, send me information. I'll keep you updated, and then we'll see how we can proceed. Yes, in a way, it'd be very interesting. But we don't want to exceed our own capacity. That's good.
Sounds good. I have another question here. Thank you for the presentation. So a big thank you straight off the hop. My question is, what would be the first step for a small 3 to 5 person team to start their evaluation process with little support from funders? Any advice on how to get started and who to reach out to? Now there is no geographical location based on that, so your answer could be just a general one, I suppose.
Okay, I'll start, and then so if you're in Manitoba, just reach out to us. We do a lot of that, more than I can. I'm not like Isabelle, that's very rigorous and she's systematic and follows up with everything. I don't even know how many organizations with help or worked with. But I mean, last year, the Bear Clan approached us to do some, and we quickly got together. We actually did exactly what the question asked. We got together a team with the Bear Clan, worked out an ideas, and an evaluation was done. So on an ongoing basis, so that is the best way to start, really. Just at least we can kind of try to provide that support, and it works quite well. And later we figure out with the organization, with the agency, what type of other support, resources, etc. But it's very feasible and it's relatively quick to do.
And I think I know who asked the question. And She's a current student in UEVal, so that's the first step. You're building your own capacity, which is fantastic. And I would reach out to ECN because I think you are locally in Edmonton and Alberta, and we try as best we can to wrap around, like Javier said, you know, pull a small team together. Probably not next week because we're teaching, but certainly that we try to be as responsive as possible, if not to connect you to the resources that you need or the expertise to support you in that process.
I'm assuming you're all going to say the same thing. Contact me. Reach out.
And
Don't
there's a lot of
hesitate.
friends. There's a lot of friends on this call actually that do the same kind of work in community. They're evaluation consultants and they're also at academic institutions. So there's a lot of support out there. I think it's just connecting to the right people.
Yeah. I'm aware we're at the 1 o'clock hour, but I'm going to squeeze one more question, and it could be really loaded for the very last question. But before I do that, I want to remind people who have to leave at 1 o'clock, please make sure that you follow up on your evaluation for our session. We love your feedback. It helps us improve, and we'll be back again in September. But the last question I'm going to pose to you guys is, in your view, what were the most promising and or worrisome findings from the 2019 State of Evaluation in Canada report? It's a deep one to toss. So. Anybody want to start?
I think I have to remember what all the findings were. I read the report in detail at that time and used quite a few of those arguments in a grant I wrote. Maybe I'll put it back on Jimmy. I think that's a fantastic area for us to explore as a learning group, to figure out, you know, what did we find? I think it's exactly this. It's the capacity, it's the requirement with fiscal constraints. Everybody's, you know, trying to demonstrate impact. And so how do we do that? But how do we do that in actual meaningful ways for the work that we're doing? Because we shouldn't just be trying to demonstrate impact to others. We also have to be using that information to inform our own practices, right? That whole notion of reflective practice, evaluative thinking, right? What's working, what's not, what do we keep doing? What do we stop doing? What do we do more of? Because it's fantastic. So, but I love the question. I think that that's a fantastic assignment for us.
Any other quick words from Isabelle or Javier on that one? No?
Well, again, sorry, I don't remember much of the report, but I still think, you know, kind of what Patton always brings up, and which is, I think the underutilization really is still a serious issue. And so we really have to keep working on that and have more ways of addressing that situation.
And I see Jimmy has thrown in here that one of the worrisome findings for him was that 30% of organizations reported that evaluation practices interfered with client relations, which one can imagine. I think even Isabelle responded to and alluded to some of that stuff in her talk as well, about just the struggle of being able to take on that work, but in good ways.
And let me add to what Jimmy said. I think this is an ethical issue as well. We should not, you know, it's using resources in a bad way that might be hurting the client. This is serious. So I agree with that.
Yeah. I want to thank the three of you ever so much for joining us today and sharing some of the ECN. I can't even tell you how exciting it is to hear how this has evolved. For everybody online, please, we need your feedback. Help us improve the series. We have one more set coming in September. So please pull up that link before you sign off. It will come in your Eventbrite follow-up. I want to remind you that that session is coming in September. And if you follow our newsletter, our Eventbrite channel or our listserv, you're going to get notice of that. Thank you so much to everyone. We look forward to seeing you again in September, and everybody be well.
Thank you.